Welcome to Dental Shots. Today we are going to see about the cursory review of immunity. I'm Dr. Mohanapriya. If you have not subscribed to our channel, kindly subscribe to Dental Shots, and let's move on to the topic. These are the subtopics we are going to cover in this video. Initially, the types of T lymphocytes, their role in cell-mediated immunity, followed by the process of antibody-mediated immunity and how you should distinguish the artificially and naturally acquired immunity, followed by the differentiation between the active and passive immunity. Lymphocytes are produced in the bone marrow, which has the large single nucleus, and processed into two distinct types called T lymphocyte and B lymphocyte. Firstly, the T lymphocytes are processed in the thymus gland, which is situated between the heart and the sternum, by the enzyme called thymosin, and which leads to the formation of fully specialized mature functional T lymphocyte. This mature T lymphocyte are programmed to recognize only one type of antigen. Even if it subsequently traveled throughout the body and met another antigen, it doesn't react with the other antigen. So, for example, if the T lymphocyte recognizes the chicken pox and it cannot react and recognize the measles virus or cancer cell or tuberculosis bacterium. T lymphocyte provide the cell-mediated immunity. The second type of lymphocyte is the B lymphocyte, which are processed in the bone marrow. Its role is to produce the antibodies, which is otherwise called as immunoglobulin production, and the antibodies bind to the antigen and they destroy the antigen. The B lymphocyte has certain resemblance with T lymphocyte because they also target only one specific antigen, and the antibody release reacts with that particular antigen and it doesn't react with any other antigen. So the B lymphocyte provide the antibody mediated immunity. Every human being encounter millions of antigen in their life. There are a number of different T lymphocyte and B lymphocyte in the body, each capable of responding to only one antigen. Let's see in detail about the cell-mediated immunity. The T lymphocytes are activated in the thymus and they are released into the circulation. First time they encounter the antigen and they are getting sensitized to that particular antigen. If the antigen is outside the body and the antigen needs to be presented to T lymphocyte on the surface of the antigen presenting cells, example the macrophages. So let's see in detail. The antigen presenting cell which digests the antigen expose the most antigenic fragment on their surface. Then the antigen presenting cell movement around the body occurs. So they display the antigenic fragment comes in contact with the T lymphocyte, and the T lymphocytes are processed and they target the particular antigen and destroy it. Whichever way the antigen is presented to the T lymphocyte, the division and the differentiation of the T lymphocyte occurs, that we are calling as clonal expansion. There are three types of T lymphocyte: cytotoxic T cells, memory cells, and helper cells. As the name implies, the memory T cell remembers the antigen which they encounter earlier, and if it comes in contact with the same antigen in future, they respond so rapidly to destroy the antigen, providing the cell-mediated immunity. The cytotoxic T cell attaches to the target cell and releases the powerful toxin which directly inactivate the cell carrying the antigen. Helper T cells are the most commonest among all the T lymphocyte, and it is very essential for the correct functioning of the cell-mediated immunity, and it also has a part in antibody-mediated immunity. The numbers fall significantly in an immunocompromised individual, example would be HIV. So the T cell produces the cytokines like interleukins and interferons and stimulate the B lymphocyte and cooperate with the antibody-mediated immunity also. Now we are going to see about the humoral immunity, which is taken care by the B lymphocytes, and they are present in lymphatic tissues like spleen and lymph nodes. They bind with the antigen without the help of antigen presenting cell. So once the antigen is detected by the B lymphocyte with the help of T helper cell, they produce two distinct types of cell called plasma cell and memory B cell. These plasma cells secrete the antibody which is specific to a particular antigen, and the plasma cell cannot live more than a day. The antibody directly targets the antigen, or it neutralizes the bacterial toxin which is released, or in turn it can activate the complement pathway. The name implies the memory B cell. They remember the antigen which they get exposed for the first time, and it produces a rapid response when the same antigen comes in contact with the memory B cell. And these memory B cells stimulate the plasma cells to secrete antibody to fight against the antigen. Let's now see about the autoimmune diseases. As we all know, the body do not develop immunity to their own cells, but there is a fine balance between the immune reaction and its suppression. If there is a disturbance in this balance, it leads to autoimmune disease. There is a marked level of antibody levels when the antigen is exposed for the second time due to the rapid response by the memory B cell. This forms the basis for the active immunization of various infectious diseases. Active naturally acquired immunity when the body is stimulated to produce its own antibody due to the exposure of the antigen, and for the second time, even if after the recovery, the memory B cells are there in the body, which is very specific for that particular antigen for the future immunity. The other one is an artificially acquired active immunity. The basis is the vaccination, wherein the antigenic property is retained in the vaccine, but it doesn't produce any disease. Rather, it stimulates the immunity, producing either a lifelong immunity or sometimes the revaccination or booster doses are needed in certain vaccinations. Next is the passive naturally acquired immunity. So before the birth, due to the maternal antibodies which crosses the placenta to the fetus, and it can be also via the breast milk to the baby, which is a short-lived immunity. Passive artificially acquired immunity. They are the ready-made antibodies which is derived from the human or the animal serum, and they are being used for the prophylactic or therapeutic administration of specific antibody. Only caution is that the protein in the serum can cause sensitization of lymphocyte, and it may lead to abnormal immune reaction at times. Hope you have understood the power of immunity. And if you have not subscribed to our channel, kindly subscribe to Dental Shots. Have a great day. God bless you all. Thank you.